Did you know that 1 in 3 people in the United States will develop shingles in their lifetime? Now that risk increases to 1 in 2 for adults 85 and older. Dr. Len Friedland is here with us to break it all down for us. Thank you so much for joining us. What exactly is shingles? Let's start there.
Hi, thank you and good morning. Yes, I'm Dr. Len Friedland, a vaccine researcher at GSK. So shingles is a disease that's caused by the virus that causes chickenpox. More than 99% of people over the age of 50 have evidence of having had chickenpox and this virus in the past, so it places virtually everybody over the age of 50 at risk. And it causes a painful, itchy rash that can last 2 to 4 weeks, and typically the rash occurs on one side of the body, and the pain can be absolutely debilitating. People are miserable with this condition, and a certain percentage of people will go on to develop a chronic pain condition that can last months to years.
Wow. And so obviously while you're going through it, as you mentioned, it's a very miserable time, but what are the short and the long-term effects of shingles?
Absolutely important. So more than 1 million people every year will develop a case of shingles in the United States. The short-term complications are this extremely painful, itchy rash that can really stop people in their tracks from doing what they want to do. Some people will develop shingles on their face, and it can affect their eye, and that can be an eye emergency, can cause blindness. And then upwards of 1 in 5 can develop this chronic, painful condition called postherpetic neuralgia, where the pain can last months, if not years, and can be absolutely debilitating. And so the best way to manage shingles is to actually prevent it, and we do that through vaccination.
Now, we mentioned that, those statistics of people 85 and older and then older than 50, but what part of our audience should look into getting that shingles vaccine?
Right, because more than 99% of people have evidence of having had the chickenpox virus. That places more than 99% of our population over the age of 50 at risk for shingles. The lifetime risk is 1 in 3, and as mentioned, over 85, it goes up to 1 in 2. And because of this, the Centers for Disease Control recommends that all people over the age of 50 be vaccinated with the shingles vaccine called Shingrix, S-H-I-N-G-R-I-X. And there's information about this vaccine at shingrix.com.
Thank you. And should we go to that website as well to just get more information on shingles in general?
Absolutely, because there's been unprecedented demand for this vaccine, and so we want to tell the audience to be patient, to get on a waiting list, find out what doctors and pharmacies have this vaccine. There's a vaccine locator at shingrix.com. More and more vaccine is coming out every 2 weeks for patients, and so shingrix.com is the best place to go to find this vaccine locator. Call your doctor, speak to the pharmacist at your local pharmacy, be patient, get on a waiting list and get this vaccine, because all people above the age of 50 are recommended to be vaccinated with Shingrix to prevent shingles.
Wow, so much great information here. Dr. Friedland, thank you so much for joining us.
Thank you very much.
Thanks to GSK for sponsoring this segment.